Hello, Namaste. Welcoming you all to the mental health blog curated just for you and your well being. Mental health issues are deeply ingrained in the LGBTQ community, and we will be discussing the cause of these issues and how can psychotherapy and psychologists help the LGBTQ community at large with these issues. A person with different sexual preferences and sexual orientation is often left out or bullied, which can leave long-term scars. The lack of acceptance by society often drives those belonging to the LGBTQ community towards substance abuse and mental health issues. Lack of friends and support system is a major concern for teenagers struggling with their sexual orientation. Growing children question the common norms of the society, but we, as a society, tend to stifle their curiosity, leading to choking their expression. Similarly, a child going through queerness comes across a lack of representation and acceptance in society. As society turns its back on the youth going through turmoil, it ends up instilling fear and negative emotions in their tender minds. This leads to mental health issues in the individuals going through such situations. Therapy offers a place of safety, a place of trust, where a person can vent out their true selves without feeling judged. Queer people who are unable to be out in the open due to fear of rejection and the social stigma involved in it need a vital shift in the narrative. A counselor can offer them enough space to ensure their mental health. The role of the therapist is to affirm the psychosocial experiences of their clients, which is of the utmost importance for people of such social disposition. Queer affirmative therapy is a therapeutic movement of significant relevance these days. Lesbian, gay, bisexual, transgender, and queer persons are viewed positively and helped to reconcile with their own identities and to build healthy relationships. It addresses the impact of transphobia and homophobia on LGBTQ clients. The therapy addresses both queer and affirmative, and it simply affirms the experiences of people in distress. Queer affirmative therapy supports and affirms the struggles of marginalized people. Queer affirmative therapists work to identify and eliminate homophobia and transphobia within themselves. This self-work is critical to their affirmation and understanding of the mental health issues that LGBTQ people deal with. Even in the 21st century, it is still a struggle for the LGBTQ community to claim their rights and occupy safe spaces that do not feel harsh on them. Queer affirmative therapy as a practice is crucial for the mental health of queer people. To say that it is not easy to live a life as a transgender individual would be an understatement. A wide variety of barriers to therapy and healthcare for such individuals to access specialist health services, especially something like gender transition services. The whole population of transgender individuals is vulnerable. Psychiatrists should remember that transgender individuals who seek consultations may be in different stages of transition. Some of them may have clear views about the kind of interventions and treatments that they might need. Some individuals might need help for psychotherapeutic assistance to explore their gender identity and expression. And some may need therapy to facilitate a coming out process. Identifying the individual's intention for seeking professional assistance is of the utmost importance. Mental health professionals should ascertain the purpose of seeking assistance before managing the problems and undergoing further assessments. The main aim of psychotherapy is to offer support to transgender individuals through the process of transition from an unsatisfying life to a happier and satisfying one. It achieves it through, first, offering optimal options to assist individuals in search of positive or desirable gender roles and expression, including aid in coming out. The process of coming out is not a one-time thing and in most cases is a recurring process. The decision to come out should be made by the individuals, and the role of the therapist is to assist and support them during the process. In the majority of cases, coming out is most comfortable when one is confident and ready. During this process, the therapist should actively screen for any mental health problems such as depression, anxiety, etc., and also assess the readiness of the individual to begin medical or hormonal transition if not undergone before. Second, improve the overall psychosocial and psychological well-being of transgender individuals. Third, assessing the stigma faced by such individuals in society and its impact on their mental health and address such issues. Fourth, validate personal experiences and emotions to provide them hope and clarity to march forward on their journey to feel better about themselves and their identities. The distress of gender dysphoria also has a significant impact on the family or partner of the individual. Family members might face guilt, may have a certain difficulty in role transitioning, and may also attach or be subject to stigma. Individuals with gender dysphoria might need assistance communicating their diagnosis and treatment decisions to their families. Family therapy can address such issues. For family interventions to be effective, it is imperative to address the concerns of families so that they can provide safe environments for these individuals. The most significant goal of psychotherapy is to help individuals achieve a sense of comfort, a sense of belonging in their gender and sexual expression and orientation. It is of the utmost importance to the therapist to direct their efforts towards achieving this. This is so such individuals can have healthy and happy relationships and get the most out of their lives. Queer affirmative therapy that tends to the need of the LGBTQ community is of critical importance in today's world, with the difficulties such people face in opening up about themselves. However, this form of therapy is a positive hope, a light at the end of the tunnel to those seeking it. It is the purpose of therapy to be accepting of the truth and realities that are at times unpleasant to bear, but with consistent efforts and social change, the LGBTQ community can finally enjoy a level playing field where their struggles and emotions feel validated and they can enjoy their lives as much as anyone else. I hope we can reach all those in need of psychotherapy and a psychiatrist to get through life. We at PsychiCare try to reach out to every soul in need of mental health care. Our top-notch expert psychiatrists and psychotherapists are affirmative and understand the issues of the person undergoing therapy. So let us build a healthier nation with mental well-being. Thank you and take care.